All right, welcome back. Time for health news. Earlier this week, new guidelines for colon cancer screenings came out. So when do you need one? Dr. Brad Jones with Baylor Scott & White joins me with some details and some new, also less invasive options so that you can kind of avoid that dreaded colonoscopy. Hi.
How are you?
Thanks for being here. Okay, so what are the, it's not new recommendations, right?
It's kind of a reiteration.
Yeah.
And there's multiple groups out there with different recommendations.
Yes.
So the ACP, American College of Physicians, kind of summarized them and said, here's our summary of all the recommendations. And they came out and said, basically, from starting at age 50, you should get a colonoscopy every 10 years. Option one is a colonoscopy every 10 years. Alternatively, you can do the stool test, where you send in a little stool sample every 2 years. That's another option, or possibly a flexible sigmoidoscopy, which is like a little partial colonoscopy, and the stool study every 2 years.
Every 2 years.
So the stool study is just a sample, and they have two different types that are pretty good now. But if it's positive, you got to have a full colonoscopy.
Right. I mean, that's also very cumbersome. I don't know if you guys have done one of those.
I have.
I have too.
and it's not as cumbersome. I would prefer people do the colonoscopy. My personal recommendation is the colonoscopy, because here's one thing. Colonoscopy is not just diagnosing, it's also preventing colon cancer.
Okay.
So when the camera's in there and the guy's doing it, if he sees a polyp, he snips it like cutting hair. It takes the polyp out.
Okay.
You don't get that with the stool sample, right? So by removing the polyp, you actually are preventing cancer, because cancer doesn't happen overnight.
Yes.
That little polyp stays there for a couple of years, 3 or 4 years, and slowly becomes cancer. If you snip the polyp every so many years, you never get cancer.
I think what people are sort of afraid of, maybe the preparation, right?
You drink all the stuff and get cleaned out the night before. It is a little cumbersome, but they've gotten a lot better techniques now. Like mine only lasted a few hours. I drank the stuff, cleaned out, and it was good. I was done and back home by 10, 11 o'clock in the morning. Peace
of mind is so great, really, right? I mean, this is one of the most preventable forms of cancer.
And on my practice, no one who's gotten their colonoscopy has ever died of colon cancer. I've had a few deaths, but guess what? They refused the colonoscopy.
Wow.
So that's personal practice. And I've lost family members from colon cancer who didn't get their colonoscopy. So to me, colon cancer is 99.99% preventable in the United States.
Yes.
If we just get our screening. But only half the people are doing it.
Yeah, so I do think it can be confusing when we talk about screening, right? Because the American Cancer Society says, hey, start these screenings at 45,
right.
And now we're hearing maybe 50, and we're also seeing an instance in colon cancer rise among young people, and it's because I think of lifestyle choices, right? All the drinking, all the smoking, what we're eating, everything.
So the American Cancer Society saw a real increase in the 50 to 54 year age colon cancer. So they said, let's start at 45. That's their basis. American College of Physicians said, well, 50 is good enough. Bottom line, just get it done. But yeah, right, things that make it worse. Drinking, alcohol, hot dogs, nitrates, food, red meat, those things all increase our risk of colon cancer. So there is an uptick in that younger generation getting colon cancer. Probably because A, they're eating bad, and 2, they're not getting their colonoscopy.
How much does genetics play?
Definitely a factor, definitely a factor. It's hard to say exactly how much, but if you have a family history, you're certainly at increased risk. And that age 50 recommendation is based on the average risk person. So if your father or mother had colon cancer at 50, you should start earlier. We usually say at least 5 or 10 years before the earliest person in your family had colon cancer.
I mean, look, things start changing in your body in mid to late 30s, and I would say 40 is a nice time. When you start to get those mammograms, why not just get a colonoscopy too?
And for people who just refuse the colonoscopy, that stool test is not bad, okay?
Yeah.
It is pretty good.
Okay.
And if it's positive, then you follow it up with the colonoscopy.
Okay, thank you. We appreciate it. Good reminder. Get your colonoscopies.